Well, today's topic is something extremely close to my heart, because it is the topic of teeth. Oh God, even just the words. I've had quite a journey. Lots of people listening to the show will know that I've had a hell of a journey over the last few years with dental work, with stuff going wrong, with having to practically remortgage to have said dental work. And along the way, I kind of feel like I've had a bit of a second, had to have a bit of a second career, certainly in terms of a very steep learning curve, let's put it that way. And recently on my dental journey, I met the lovely Jenny Moore. So I thought, who better to get on the podcast than somebody else who's also on a dental journey? Welcome, Jenny. How you doing?
Yeah, thank you very much for inviting me on, Janey. I do appreciate it. Yeah,
Well,
what a journey! What a journey is it?
what a journey. I know. Well, you and I met because we were, well, sharing horror stories, basically. Let's not put too fine a point on it. And then bonded over our horror stories. So I suppose as a bit of a precursor to this discussion, we should probably say that as a bit of a disclaimer, neither of us claim to be medical experts. Neither of us claim to be dentists. We are not giving you medical or dental advice. But what we would love to do is share a little bit of our own story and some of the stuff we've learned along the way, because with that experience comes huge amount of expertise. And I suppose really the way I kind of think of this is um, if I can help one person not have to go through what I've gone through, then I'll feel very grateful for that. And there's an awful lot of stuff that I wish someone had told me years ago. There was that old Pam Ayres poem, wasn't there? I wish I'd looked after my teeth.
Yeah,
Oh, didn't have to remember that. Um, so Jenny, both of us have been down the route of what's known in the UK, well, and the world as biological dentistry. So there'll be people listening who don't know what that means. So we can get into that discussion. I suppose for me, it's a case of when I first realized that I had dental issues, I realized that a lot of those issues were down to the fact that, well, not to put too fine a point on it, dentistry in the UK is a mess, really. It's actually a mess. And I'd had some pretty shocking work done. And because I am very holistically minded and I like to do everything as holistically as possible, I realized that there were certain procedures that I absolutely didn't want anymore. And so I went down the route of biological dentistry. And it would be marvelous if we could say that is the answer. But sadly, as we're going to reveal, it's not necessarily all it's cracked up to be. And we will also talk about the fact that one of the reasons people choose biological dentistry is because they want mercury removed, for example. That's something we'll talk about. They want to go a different route to typical root canals. We'll talk about that as well. Um, but just to sort of set the stage that both of us got ourselves into a pretty terrible situation, which resulted in us seeking help with biological dentists. So let's start there. Jenny, tell us a bit about your story. I know it's really long, so
yeah. Wow,
we've
yeah,
only
I'll
got a
try.
fairly short podcast, so I might have to interrupt you.
Yeah, those that know me know I like to talk, so I'll try and find a way to summarise. Yeah, so I'm 60 this year, and 10 years ago I had unexplainable swelling on my gum where I had an area of sort of a grey colouring, which I've never even really took any notice of, to be honest. But this area swelled up to the size of a pea, and I couldn't move my head. I was in so much pain. Ended up in emergency department. I had x-rays, scans, nobody knew. Went to my NHS dentist. They told me it was fibromyalgia. I then went to my rheumatologist who said, no, this is dental. And that was the moment I entered the biological journey of trying to find somebody to help me, because it came clear that nobody knew what was going on. So, yeah, so I've lived the last 10 years in 24/7 pain and lots of other symptoms, numbness, tingling, burning, all sorts of things in my mouth, but also it impacted on the whole of my head, from my crown. It was like I had a line going down the middle of my face. It was my nose, my ear, my eye, my neck. And then gradually other symptoms started manifesting on the left side of my body. And I've literally toured, I think, nearly the whole of the UK other than Scotland, trying to find a biological dentist to help me. And it's been the most, I thought it was the answer. And then I realised it's not the whole answer, because the mouth is just part of it. But it shocked me, the realisation of the service that's being provided in the UK by that sector. It wasn't what I thought it was going to be. So it's a bit of another whammy. I'm now mopping up the aftermath of the biological dentists as well. So I'm on, probably like yourself, we're on a third layer. We've done the mainstream dentistry, we've done the biological, and now we're on another path of trying to, it's a whole aftermath of the procedures that we've had done over our lifetimes, which is and when you realize the depths this goes, it's really, I'd say traumatic, and it's petrifying at times. Yeah,
It is. It really is. And, I think, I mean, maybe we should just start by, I don't know if how well you might be able to describe it, but there might be people listening who are kind of thinking, well, what's the problem? You have something wrong with your teeth, you just pop off to the dentist, you have something pulled out, or you have a filling, or, well, what the hell? But actually, the reality is, what's going on in your mouth is so connected with your whole body health. And I'm still not sure I really realize the extent of that. I've had to really relearn that in the last few years. How would you describe that that sort of whole health thing when it comes to the mouth?
Yeah, well, the way I would describe it, I mean, from recent surgeries for instance, I've had a lump in my left armpit. I don't know if it's connected, so I'm just feeling it's no coincidence. For over a year, I thought I'd got breast cancer, had went to breast clinic, and since my surgery, which has hopefully resolved a problem, that lump has now disappeared. And I have no pain in my left breast anymore. Swelling in my face has gone down. Burning mouth syndrome has lessened significantly. So from my surgery, I've noticed a lot of positive changes that I've lived with for a long time. So I'm not really fully versed on meridians. For those people that are into, the Chinese thing, all the meridians, I can't really talk about that. But I do strongly believe, there's a page on my website showing a diagram, which I think is great, of the inside of a skull and a jaw, showing you all these interconnecting things. And
each tooth connects to a meridian, doesn't it? It's
so
fascinating, a different organ.
I do believe they impact on the rest of our body. And it's frustrating for me that it's like when you go to a GP, if you have a problem after dental surgery, they don't want to help you because they say it's a dental problem, and then a dentist can't help you because it's a body problem. So there's this massive grey area between the overall health, general health, and the dental health, where in fact it all connects up. It is
Absolutely. Absolutely. Yeah, that was exactly the issue with me, because the poor dentistry led to a massive sinus issue, which as you say, the biological dentist said was absolutely nothing to do with them, although it absolutely was. But the sinus doctor couldn't understand that it was dental. So had I just gone down the route of having a sinus treatment, it wouldn't have actually sorted the problem, which was a massive infection left by a badly done root canal that was then extracted, but the infection was still left in. So yes, you're absolutely right. We need joined up thinking, for sure, and we don't have any. You're also absolutely right about the impact, because again, like you, I'm not an expert on the meridians or the connections, but I absolutely know. I've seen it for myself. My husband had a whole bunch of implants removed. They were titanium implants. Titanium implants can so often get infected. And interestingly, when titanium implants are put in, people are never tested for their reaction to titanium. Yet lots of people have an intolerance or an allergy. But he had titanium implants removed that were massively infected, and the result of that was that his eye condition that he'd been told was, oh, just age related, macular degeneration, just you'll have to just take have medication forever. Cleared
Yeah,
completely.
yeah,
And it's quite incredible when you see it for yourself. It's like, oh my God, it's a miracle. Well, it isn't really a miracle. You've taken the infection away. You've taken away what was feeding the problem.
yes.
And yet, it is quite staggering that within the medical profession that we have, and sadly, many of the UK dentists, they don't look at the holistic picture. They just don't look at the holistic picture.
Hmm.
So let's just get into a bit of detail then. So with you, your tell us about your really nasty experience. Was it 10 years ago
Yeah, so it was
with a
the
biological dentist?
yeah, so it was the swelling, and I went to see many biological dentists, and I shared my journey publicly of of those experiences. And then I settled on somebody who had decades of biological experience. They were trained by the infamous Hal Huggins, who I believe is the founder of holistic biological dentistry. And I'm thinking, you can't get better than this. So that was where I went. And the outcome of that was it's not funny, really. I had my procedures with an IV sedation, and I decided to have all my root canals out, carry on having all my amalgams out. And I thought, at the end of that, that'll be brilliant. I'll be infection free and metal free, and I'll be able to get my health back. So I've got an autoimmune thing going on. Yeah, so the outcome was I was woken up from a procedure where the dentist knocked a drill bit down my throat. He was
So
struggling
during the procedure, the
during the
drill bit.
procedure, so I was
Yeah.
under sedation. So it was difficult to get the root canal out. So he used two instruments and knocked the drill bit off.
Wow.
So I was woken up from sedation, blood everywhere. My husband called, taken to hospital, and I had to wait for this I don't know if it was 2 millimeters, 2 centimeters, I can't remember now, but it was a metal screw, which it's on my Instagram page. I put photos up of it. So I had to wait 72 hours for that to pass through, not knowing if it was going to perforate my insides, and it was the most horrific of times. And then I had to go back to finish the process, and that cost me another £1,500 in sedation and all the anxiety. So basically, that dentist was suspended under investigation.
As a result of what had happened to you.
Yeah, so he was
Yeah.
suspended under investigation, and then I found out there was a case before me with a patient that I don't know who that is, and he had conditions placed on him by the General Dental Council. And for those that don't know, they're the regulator for our dental clinics. And it turned out he'd broken all the conditions placed on him to practice. But not only that, he was working without indemnity insurance.
Wow.
So I had
Which
to,
meant that there was no way you could make a claim, which and in any
yes,
normal situation, you'd at least be able to make a claim against what's happened to you.
yeah. So I found that quite, well, beyond shocking, really. And I
Yeah.
asked another dentist, I said, what do you do when you register? What's the process? So basically, for those that don't know, dentists purely have to tick a box to say, I am insured. The General Dental Council do not monitor dentist insurance, and I'm told this is actually more common than what we could imagine.
Mm. And
Um,
also, this particular dentist was working out of another clinic that's very, very well known for
yeah,
very expensive biological dentistry,
yeah,
and obviously they hadn't checked his insurance either.
yeah. So and that is shocking, because I think if I owned a dental practice, or even if it was any sort of business where I was letting somebody come in, use my equipment, my staff, my payment system, would you not, and knowing that person had already had a complaint with conditions placed on them, wouldn't you make sure that that dentist is working under the correct way? Yeah, so the outcome of that is that, just to make people aware, if it's discovered your dentist doesn't have insurance and something goes wrong, no legal barrister, lawyer, anybody will represent you, even with a strong case, because there is no guarantee they will get their money back.
Yeah.
Because the dentist, so they can work illegally. The GDC illegally do not check the insurance, and then the victim, the patient, has no way of getting that back. So that ultimately cost me £10,000, that experience,
Yeah.
with no way of getting any recompense.
And you
Um,
still had the problem.
And you still and well, yeah, now I mean it left me with more problems I've since discovered where I've now had to pay again to put right the work of that dentist
Yeah.
and other
So, but
dentists.
over the years, you then went to other biological dentists
Yeah, so
across the UK.
before I found this one, I went to all the well-known ones that everybody in the dental community talk about. But there was something not right with different ones, and I came across so many egos and marketing, and it was, mind-numbing, really.
Mm.
And I settled on this one because of the Hal Huggins thing brought a sense of
Credentials, yeah.
trust. So
Yeah.
brought a sense of trust for me and safety. Um, I think it was 40 years that they'd been a dentist, and they were working out of this well-known, highly thought of biological dentistry in the thick of London. And
Mm.
I'm thinking, well, what could go wrong with this?
Mm.
Well, everything went wrong.
Hmm. And then, since then, you've been to other biological dentists within the
Yeah,
UK and
yeah,
had other issues, because there might be people listening thinking, okay, so it's an absolute one-off, it's a one-off. All the other biological dentists are all absolutely great. But sadly, that's not been the case either. Because I know that for you, you kind of set up a website, but also a little bit of a sort of support group almost for other people who'd had issues. And
yeah,
over the years, I know you've actually been collating a whole bunch of other people who've written to you and said, "Oh my God, I went to X and Y biological dentist and this problem happened." It's quite shocking, actually, isn't it?
yeah. I think because I was putting my story out because I wanted to raise awareness. But it's very difficult if people aren't aware of what biological dentistry is. Like you say, it's the drill, fill, and bill, isn't it? Approach
Yeah.
to dentistry, and um, I've shared awareness, but in doing that, I over the last 4 years, I've had so many people, they private message me on social media, and it opened up a lot of floodgates. But there was already support groups for people in the situations that we've been in, which I then saw I mean, it's a pandemic in itself,
Yeah.
not just to the UK, but I'm just talking about the UK, but I can see it's a global issue. Um, and when you realise the extent of how this is and how much suffering there is, it's shocking. And that's why I was, really grateful for you to invite me on today, because we share a passion that if we can help prevent people ending up where we ended up, that's going to be a huge thing. And that's making me all
Yeah.
emotional
No,
now. But
absolutely. I
yeah,
mean, one of the big issues and one of the reasons why often people rock up to a biological dentist because they've become aware of the issues with mercury. Now, mercury is such a big topic,
mm,
and despite being very holistically minded, for years and years and years, I was under the illusion that yes, I had mercury fillings because I was given mercury fillings as a kid. And no, they weren't affecting me because I'd had them ages. And there was this theory that, well, if it ain't broke, don't fix it. You seem to be fine. The amount of dentists that told me, oh, well, it's completely inert. It's it's not leaking into your body. It's absolutely fine. You don't need to worry about it. Oh my God, I had so many dentists tell me that. I can't believe it. And when I finally woke up and realize, no, hold on a minute, whether you like it or not, it will be affecting you to a greater or a lesser degree. That's the point at which a lot of people seek a biological dentist so that they have the proper removal procedure, because with mercury it's not just a case of whip it out. Interesting, that, isn't it? We now know why it's not just a case of whip it out, because it's so toxic. That'll be why.
yeah,
I remember a colleague of mine who you've also met, Becky, telling me about a really interesting documentary with Terry Pratchett. I haven't actually seen the doc, but I must watch it because she described this documentary that they made with Terry Pratchett, and he was really open, talking about his diagnosis of Alzheimer's. And they did a whole bunch of things on this documentary. And one of the things they did was remove mercury, because, of course, there's a direct link. Many people would say there's an absolutely direct link to Alzheimer's. And he had his mercury removed on screen and, on camera. And the dentist, they kind of hold up this piece of mercury. And Terry Pratchett says, "Oh, wow, can I keep that? I'd like to use it as a cufflink." And the dentist goes, "Oh, absolutely not. It's highly toxic. Like, how dare?" And you go, "Oh, but it's been in my body for, 60 years, and you thought that was okay?" And then the camera cuts off, and she described that to me. And I thought, doesn't that sum it up? Doesn't that
Oh,
actually sum it up? So anyway, where was I? So mercury. So we need safe removal of mercury, and so many people rock up to a biological dentist. Um, I'll share a tiny bit of my experience there,
mm,
and then you can share yours.
mm.
So with me, when I finally realized this needed to be done, I rocked up to an unbelievably expensive biological dentist in Harley Street and asked for my mercury to be removed, paid several thousand quid. They took the mercury out and said, "Congratulations, you're mercury free." So I thought, well, thank God. There were then other issues, which I'll go on to in a moment. But it then transpired 2 years later, or a year and a half later, when I finally managed to get proper support and help, which was not in the UK, sadly. That the dental surgeon looking at my X-ray said, well, in addition to all the various horrendous infection and horrendous issues you got going on, I thought you told me you've been to a biological dentist because you, hold on a minute, you got mercury in your mouth. I said, no, 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 I haven't. I had it all removed. He said, well, no, you didn't, because here you go. There's at least 3 more pieces of mercury hidden behind crowns. Apparently, it's a very common thing to do in the UK. Give someone a crown, shove a bit of mercury under it. Now, granted, I hadn't asked the biological dentist to remove all my crowns, granted, but they had never once alerted me, despite having seen Panorex X-rays and God knows what, they'd never once alerted me to the fact that there was hidden mercury, which would also be affecting me. So I was pretty furious about that. And, now I actually am mercury free. Can't tell you how bloody grateful I am, because I've met so many people along the way. I met one guy who has Parkinson's disease. He's absolutely convinced that it was down to mercury poisoning. That he ended up in that scenario. So tell me a little bit about your little mercury story.
Oh, well, my mercury story started in 2018, I think, where I had my lower jaw changed from amalgam to composites. And then I spent 2022 till 2025 trying to put one of those teeth right that was just a total bodge up, really. So basically, there'd been a gap left underneath the filling, which I wasn't aware of. I thought, great, I'm halfway through having all my amalgams out. This is brilliant. And then it was it's funny enough, you're saying Harley Street, that's where I had the incident with the screw. So that was, anyway, so I went there and I begged for that dentist to take this particular filling out. I said, something isn't right, it's not right. And he refused to do it. He said, there's nothing wrong with it. So then I had my top amalgams replaced with him. And then I hadn't resolved this problem on the left side of my face. And I just felt in my inner knowing was it was from a procedure that I had done probably 35 years ago. But
With a conventional dentist many
with
years
with
ago,
a
yeah.
conventional
Yeah.
dentist
Yeah.
with and I've told every single biological dentist there's something going on in this upper left of my face and nobody's listening to me, and they're making me feel like a hypochondriac, really. So yes, so like you, I'd had my surgery in Harley Street with a different dentist yourself, and I came out and I did a video and I said, oh wow, on my YouTube channel, oh wow, I'm infection and mercury free. I felt like I'd won the lottery. I was just so freaking happy, but I'd still got all these symptoms in my face. So this year I've had surgery overseas also, and the plan was to just go in and clean up some jawbone surgeries from the dentist in Harley Street. So when the surgeon went in, he found a fleck of black in my upper left jaw and went in, and I basically had an amalgam cavern in my face. And this is six
Just
weeks ago.
explain what that means for anyone who doesn't
Okay,
know
so
what you
this
mean.
was only 6 weeks ago, so it's early days for me, but basically you saw a fleck of black opened up the site, which went up into my cheekbone, under towards my eye. And there were 5 pieces of amalgam that were between 1 millimeter and 2 millimeters each.
Wow.
So I had to
So
have
it's
that.
as if the mercury had literally traveled, which
It
is
had
what it does.
travelled. It
Yeah.
had travelled into the bone. So I've had jawbone cut away, and it had gone into my soft tissue of my face.
Yeah. And then
Uh,
the expression is, I've heard the expression mercury tattoo. So that's what you mean when you refer to the black.
yeah,
It literally makes a mark.
yeah. So that's what I think now. I understand more so that 10 years ago when I had that grey colouring on my gum, that was an amalgam tattoo
Yeah.
from the procedure that I'd had done over 35 years ago. And I can only assume, and the surgeon seems to agree with me, is that the procedure I had done 35 years ago is called an apicectomy. And you have one of those when a root canal fails, because root canals, do, as far as I'm aware, do not last indefinitely. At some point, they either have to be retreated or people have the tooth out. So when the root canal fails, they do this procedure where they take all the inside of the root out and they pack the root tip with amalgam.
Oh, God.
So my theory is 10 years ago when my gum swelled up, I think that amalgam must have burst out of the tip of my
Yeah.
tooth area.
Yeah.
That's the only thing I can
Yeah.
think of. And interesting, I went and had one extraction under general anaesthetic at an NHS hospital, and I had problems after that. And I went back to see the duty dentist, and I said to her, I said, I'm sure this is to do with this apicectomy. And she said, oh, those were the days when we used amalgam before we understood.
Did she?
And I'm sat in the chair and I'm thinking, wow,
Yeah.
just wow. And you're still putting amalgam in people. And I also had a consultant maxillofacial surgeon at another NHS hospital. And he said to me, the NHS have done this to your teeth. He said, if you
Yeah.
lived in Australia, you wouldn't have this. And I could see the nurse behind visibly cringing.
Mm.
Um, so
Yeah.
yeah, so now that amalgam, I had photographs taken of inside my jaw, so I've seen the start of where it opened up. But it was described to me as it opened up into an amalgam cavern.
Wow. Wow.
So I'm thinking, wow. So and I've been told by the last biological dentist that treated me, you have a fleck of
Yeah.
amalgam in your jaw.
Yeah. Yeah.
And it wasn't a fleck. Another dentist told me there was no amalgam. So, like I thought I was amalgam free, where it ended up a total
Yeah.
mess.
Absolutely. And again, for anyone thinking, don't be daft, there's no problem with it. Now the EU have in fact, I have to get this bit right. It's not a total ban on mercury, it's a ban on more mercury being brought into the UK. Have I got that right? Have you seen all the info? It, I think it's from the beginning of 2026. So it's being phased out now. And I think I'm right in saying from 2026, it's an EU directive that you won't be able to buy the mercury.
Okay.
And again, unless I'm mistaken, I haven't got all the technical stuff in front of me, so
Mm,
don't quote me on it. But unless I'm mistaken, the British Dental Council are not happy about this
mm,
because their view is that mercury is inexpensive, durable. They want to carry on using it.
mm.
Now, I would argue actually it's highly toxic, and utterly crazy not to look at the fallout
Yeah.
from and if you look back at mercury and its effects on health, not just in dental treatments, by the way, mercury in vaccinations as well. Many vaccinations contain mercury, and there's been so much ill health tracked back directly to it, that it's quite staggering that it's still used.
Mm,
To this day, it's really quite staggering. And now, whereas I used to think, okay, well, if you're unlucky enough to have mercury in your mouth, then let me just recommend you find a way to get that mercury removed safely. Now I feel at a loss as to how to recommend people do that, because I paid about as much as it was possible to pay, and I still didn't get rid of the mercury. So I suppose really this chat that we're having now is going to be of most use to you if you're not in a mess yet. So please, if you're listening to this and you do not have any mercury and you do not have any root canals, oh God, I can't stress enough. Don't do it. Don't ever do it. Don't start down that slippery slope of intervention, because mopping up is really, really tough, really tough. And the reason I wanted to have this chat, with you, Jenny, is because people don't know what they don't know, that lovely expression, but you don't, do you? You don't. What you'll be told by dentists is that mercury's safe and that root canals are safe and always better to save the tooth. Well, you know what? I'd argue better to save your life, actually.
Yeah.
Yes, it's unbelievably distressing if you have a situation where you've got to lose a tooth. Unbelievably distressing, but nowhere near as distressing as years and years and years of ill health, probably resulting in an early death, or in the case of one woman I know, ending up in a wheelchair through toxicity, literally through toxicity. So unless you've got anything to add on the mercury, we can move on to the happy
I
topic
mean, the
of
one
root
thing
canals.
I will just say very quickly about, when you're younger, it's like everything, isn't it? Whether it's food or alcohol, late nights, clubbing and all that. When you're younger, your body's got the capacity to
deal with it
cope.
better. Yeah.
But decades later, that's when, or even less than decades later, that's when things start surfacing. So it's just it's, if like you say, if we'd have had the knowledge when we were
Exactly.
back then, but here we are now, when we're sort of, hopefully it will help some people.
Well, you never know. I mean, I did speak to somebody that I know about a year ago, and she literally just rocked up to a regular dentist. She had no root canals, no mercury, thank God. Really good teeth. She was about 45 or something. Really, really good teeth. But then she was told by this dentist, "Oh, we're not quite sure what's going on here. Looking at this X-ray, we're not really quite sure. We can do a root canal, or we might have to remove the tooth. We're not really sure." It was a very woolly kind of discussion, and thank God I was able to kind of get to her and say, "No, go and get another opinion, get a proper X-ray, but whatever happens, do not have a root canal." And I think probably after hearing my horror story, she made that decision, thank God. So on to root canals. I did write a Substack post. I'll put it in the link, called "Why I'll Never Have a Root Canal." And I mean, I could genuinely write a whole book on this one, really, but I'll save you the whole book. I think one of the kind of top lines when it comes to root canals that it's worth stressing is that I've done so much research now, and I genuinely don't think there is such a thing as a okay root canal. I don't think they're ever okay. As you rightly say, there'll be an element of how much your body copes well. But if you have a choice, why would you do anything to your body that is going to create, toxicity, if you have a choice not to? So I mean, just to share a tiny bit of my story, I now know, of course I didn't at the time, but I now know that a root canal that I had probably would be around 10 years ago now, when the dentist did that root canal, and again, talking really expensive dentist here, we're not talking anything crappy. This was a really expensive dentist. When that dentist did the root canal, we now know that dentist breached the sinus. Now, interestingly enough, the surgeon who looked at the X-ray and said, "Well, it's clear what's happened here," said the dentist probably would have known. A bit like when you're trying to put a drill in a wall, you kind of know when you've hit something, right? But anyway, so he breached the sinus. I remember I kept going back. I went back and I went back and I went back for 5 years, saying something wrong, and they kept doing X-rays and they kept saying, "No, it's all good. All looks good. No infection there. All seems absolutely fine. All looks great." I knew there was something wrong. It never felt right. And then a couple of years over the whole COVID era where I didn't see a dentist, neither did anyone else. And over that period, things were getting much worse until I eventually went to see a dentist who said, oh, this whole area is really badly infected, serious infection here. You're either going to need to have these 3 teeth removed or one removed and a couple of root canals or whatever. At which point I thought, okay, I absolutely have to go to a biological dentist, do this properly. That was the point at which I went to a very expensive Harley Street biological dentist, had the mercury removed first, or so I thought, then had the 3 extractions, and allegedly all the infection, removed. Spent an absolute fortune, as you can imagine. Came away and this area didn't heal at all. Kept going back, kept going back. I knew there was still infection there. I could sense it. It was bizarre. Went back, nothing. Oh, do a salt rinse. Until eventually I was told, oh, it looks like you've got a sinus infection. That's nothing to do with us. Go and see a sinus doctor. So I go and see a sinus doctor who says, oh, you've got a sinus infection. You better go and have sinus surgery. But I absolutely knew that this was connected to the dental issue. So I knew that if I went and had sinus surgery, it wouldn't sort the problem out. I just had that knowing. And thank God, because when I finally got the help I needed, yeah, there it was. Clear as day on the X-ray. Okay, you've had a breached root canal. Then when the biological dentist removed that tooth and allegedly removed the infection, didn't happen to notice that there was still a ton of infection, basically going right up to my eye. I'd be one of those people who would have dropped dead. You hear about them all the time, don't you? Oh, she dropped dead suddenly. Brain aneurysm. Oh, sudden. Oh, such a shame. Nobody ever goes, wonder if she had a root canal and a massive infection. So there's my little root canal story. Pretty hideous. The surgeon said to me, this is not natural. This is 100% bad dentistry.
Yeah.
And I remember saying to him, I don't understand. I've been to so many dentists, expensive, allegedly really good dentists. Why wasn't this picked up? And his answer was, I forget the actual phrase, but it was something like, if the brain is blind, the eyes can't see.
Yeah.
Oh, wow. Now that's interesting.
Mm.
And so I then went on an absolute mission to find out about root canals. I then realized that my son had been given a root canal at the age of something like 14 and a half without our knowledge. I've been told, which I now know is not even legal. They'd said they were doing a filling. They'd given him a root canal. That had to be removed. I mean, fortunately, in inverted commas, it failed in inverted commas. I'm glad it did, because at least we knew. But then he was still left with issues, and we were thinking, what the hell? And then it transpired that the biological dentist that removed his root canal there was then a cavitation. We'll go on to that later, because a lot of people don't even know what that means. So then we're on to another whole thing. You've got the issues with root canals, you've got the issues with infection, you've got the issues with potential cavitations. I mean, God, where do we start? Right, your turn to have a rant. Go on, off you go.
I don't even remember if it was 5 or 6 root canals I had out. I can't even remember. That's my memory's terrible. But for me, I think why do people? I'm thinking, why did I get a root canal? I think my first one was probably in my mid-20s or something. So, and I think it's not great even in your 50s having to lose a tooth. But when you're younger, I think there's that. Oh, I can't have a gap. I can't have a. So I think it's the aesthetics that people are. I mean, look at all the people that are going abroad now and having their teeth filed down that are healthy just so they can have white gleaming pearlies.
Yeah,
and you
crazy.
just think, oh my God, that's another story. But yeah, but it got to a point, because I developed the autoimmune stuff and chronic health issues. And then learning about the biological dentistry, I just thought these have to come out. It was logical to me that why would I, like they say in all the things you read, isn't it? You know, if you have a gangrene foot, you don't keep it on, you chop it off. So you've got a dead tooth in your face. Why would you keep something that's a bacteria breeding ground in your face?
Yeah,
So
exactly.
it's, yeah, so that was me. You know, my mercury, I suppose, has been a bigger topic for me than, even though I had a lot of root canals. It's not something that I've dwelled on too much. It's like, well, I've got them out, so they're gone.
Yeah,
But for me, it was the aftermath of what that left behind.
yeah,
So
absolutely.
the root canals has been a chapter, but not a big focus for me. It's been the before and after, really.
Sure. And
Mm.
then, well, I mean, I should just mention at this point, because I think it's very powerful that one of the interviews I did, which you welcome to go back and listen to, was an interview with Thomas Levy, who's a leading cardiologist who's written God knows how many books. And I interviewed him after I saw a paper that he'd written um, about root canals and breast cancer.
Mhm.
And he agreed to be interviewed, and I got him on the line, just as we are now. And I said to him, Dr. Levy, I'm really interested in the paper that you've written, where you're talking about the link between root canals and breast cancer. And he said, no, 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 I need to stop you there. And I thought, oh God, I've got it wrong. How embarrassing. And I said, oh, I do apologize. And he said, no, 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 I did not say link. I said cause.
Mm.
Why root canals cause breast cancer? And
Mm.
oh my God, now that's hard hitting.
Yeah.
Um, and the reality is, we don't know exactly what they're going to cause, but they ain't going to be good. So
Mm.
I can't stress enough. I, I don't believe there's ever a reason to have a root canal. There's so much information out there now, and yeah, of course, it's not great to have a gap.
Mm.
No, it isn't. But
Mm.
but it's preferable to having, as you say, something dead left in your body. And there are now um, really good zirconia implants that work for many people, depending on where it is in your mouth, of course.
Mm.
Because again, then leads on to other topics like when you leave loads of gaps in your mouth, that's not good either. There's all of that. I mean, we could talk forever. The cavitation thing. Tell me what you know about cavitation, because it's a word that I had never heard of until about 3 years ago.
Yeah, so this ties in with carotations. So I'm just going to backpedal a bit, just a small thing about the root canals. I was so desperate to find out. I really believed my teeth were causing my ill health. I posted my root canals to the States to have them analysed, my DNA analysed.
When you
And
say you post them, what do you mean? You the
I sent them
X-ray,
by air to America to have my teeth
the
analysed,
actual teeth
the
that
teeth.
you'd had removed? Oh, how
Yeah.
interesting!
And I had a report, which I don't think I've put it on my website actually, but I had a report done and it tells you what infections were present,
Wow.
what parts of your body they impact on,
Oh my God! Wow.
and what medication you need to clear it.
God.
And out of 24 of those infections, 16 were deadly serious,
Wow.
life threatening infections for me. Not one biological dentist I have seen has been remotely interested in that report, even though on social media they plug that report and promote it and everything to their people. And I'm thinking, so why is it I present my report that I've paid a lot of money for and none of you? Because they don't know. They're not
Mm,
doctors. So anyway, I
mm,
just got to throw that in because I proved what infect. Now, whether that infection has remained in my body after the teeth were extracted is another question that I don't know. No doubt there's more expensive tests you could have done for that. But in hindsight, I wish I'd have done that after the extractions
mm.
because it's obvious for those that know about root canals, your jaw is going to be bursting with bacterias.
Yeah.
But yes, I just thought I'd just say
Yeah,
that.
no,
It's that
absolutely.
important. Yeah.
So,
Um,
so on to cavitations. Just
yeah.
what do you know about cavitations?
So cavitations for me are in my layperson speak is that where you've had an extraction um, and the extraction site hasn't been cleaned out properly, you're basically left with, this is how I explain it, you're left with a hole in your jawbone,
Yeah.
which should, we would think, grow back, but it doesn't always grow back. And then what happens is it fills with a jelly-like substance, which is a breeding ground for bacteria. That's the way I would describe it.
Yeah.
And on my Instagram, I've got a video reel of a dentist draining a cavitation site. So
Nice.
people can look and see what that looks like. So it actually looked like black oil coming out of my
Yeah.
jaw.
Yeah.
So this does exist. It is a thing.
Yeah, absolutely. Now,
It
you know,
is
the
a thing.
interesting thing here is I mean, I'd love to be proved wrong, but I don't think a lot of regular dentists in the UK even know what cavitation is.
No.
So again, my son, who'd had the root canal put in when he was young without our permission, that was taken out by a biological dentist, and he was still having issues, pain and all kinds of issues. And we're thinking, well, this is bizarre. There's something strange here. So he went back to a regular dentist, unbelievably expensive regular dentist in London, who did a very expensive 3D X-ray looking at the site and said, it's absolutely fine. There's no infection. There's nothing. It's really healthy. It's nothing to do with that, any of the pain or health issues. It's not connected at all. So off we go, take him eventually, off we go to the surgeon, not in the UK, who says, we got cavitation here. Now, I don't think they even know what that is in the UK. I mean, what the hell? And that was the result. That was the root of all his issues. That's why he had the pain. That's why he had lymph nodes, raised lymph nodes, because there was a
Yeah.
cavitation.
Yeah.
And thank God it was found now. Thank God. I mean,
Mm.
can you imagine, you know, and people are walking around with these goddamn ticking time bombs.
Mm.
They really are. And you're right, you know, yeah, that's a good explanation of it. I mean, they can really vary in their depth and size
Yeah.
and all the rest of it, but not enough people know about them for sure.
And then what I found with the dental community who've contacted me over these 4 years, yeah, I know people because these infections they can become systemic.
Yeah,
So you could go in and have all your jaw cleaned out by the bestest of the best. If you don't deal with what's going on in your body, what happens with people that I know is it goes wham and it goes straight back into the jaw. And I know people who've had 7 repeat surgeries on one cavitation site and they're still bedbound,
wow,
sick.
wow. Because then, of course, oh God, I mean, honestly, this topic, you scratch the surface, and there's a whole bloody well underneath, isn't there?
We should do
Be
an episode for
because
each topic.
we should, because then with and by the way, if anyone's only just tuned in, we did say at the beginning, we aren't dentists, we aren't medical experts, we are not giving you medical advice. We're just sharing our own experience in the hope that it just might make you think, okay. You never know. But the issue that I've come across is, you know, with friends and colleagues, is that they have these cavitation surgeries, and then they have a lot of bone loss. So
Yes.
depending on your age or whatever, once you've got bone loss, then you're into another set of problems
Yeah.
with needing to augment the bone before you can you know, add an implant or whatever it might be. So, oh God, I mean, the repercussions are phenomenal, really, aren't they?
Mm, mm,
They really are.
yeah.
So, what's the good news? Is there any good news, Jenny? Do you have any tips? Any tips for somebody who is not as messed up as we were?
Well, I've written a list. I've written a
Okay,
list
good.
of my top what I would say to people.
Okay.
Um, so the first one is I would say the best way to find out real information is by maybe joining the various Facebook groups for biological and holistic dentistry called NICO, NICO,
Yeah.
and hearing about it. I came out of them because the reason was people are very stuck and they can't in this country they cannot get anybody to help them, and it can be a little bit difficult. But if you want to go in there for a short while to gain information, I would say that would be really, really helpful. And word travels fast amongst the dental community on both positive and negative outcomes. So you get the real information without it polished. So for me, my first port of call, which it would be for whatever we buy, I suppose, a lot of people, you go on the website of any provider, don't you? But for me, my first port of call, I would go on a website, and the first thing I look at is their price list. And I want to see what treatments they are offering, because that will reflect their true ethos. So if they are offering root canals, for instance, I would say, well, are they truly biological then if they're offering root canals? So the price list and list of treatments will tell you a lot. Don't be influenced by the look and feel of a website. Don't be influenced by social media content of any dentist, testimonials, or numbers of online followers. Because I know for a fact from people I've spoken to, online platforms on social media are being filtered, so they only present positive feedback.
Mm.
The whole sector for me is one big marketing, which is, I won't go off on that because I'll get annoyed. But marketing strategies are designed to attract business. And unfortunately, you are the business and you are no more than a commodity to most of the dentists. I won't say all of them because that's not fair, because I don't know every single one. Some of the best dental providers are the ones quietly doing their thing away from the noise of social media. So they're the ones you need to seek out. Don't choose a dentist based on convenience to where you live, because you may end up in years to come needing to travel much further to resolve issues that may manifest. Find out the clinic's policy for accessing your dentist following any procedure that you may have, because it's not unusual for patients to be left for weeks, sometimes months, in a painful crisis where they can't even get through on a phone to speak to somebody, let alone be seen. So some dentists, don't say a lot, some dentists, they're keen to get you in and will bend over backwards. But once you've had that treatment and paid your bill, you're on your own, really. And it's a scary place to find yourself. And I've nearly finished. Check your dentist has indemnity insurance to make sure you are protected legally if things go wrong. And finally, remember, it's not about what your teeth look like so much. There is a much bigger picture to consider, which hopefully today will have enlightened you onto some of that. By focusing on aesthetics only, you can cause damage to your teeth that you may regret in years to come.
Yeah, absolutely. Well, in
That
my memoir, From Wham to Woo, I at the end I have my 12 rules for life, and number one is never have a root canal. So, so I can sum it all up with that. And obviously never have mercury. But yeah, you're absolutely right. And just to say, by the way, on that, in my case, when I did my research for the biological dentist that I went to, um, I mean, I have to say, I could not fault their paperwork, their marketing blurb, their list of everything I mean, it really did look perfect on paper, sadly. So I don't know what the answer is there. It's a really, really difficult one. But this is worth putting time and attention into, for sure. It really is. I mean, we should also stress, of course, that if you're lucky enough to be young enough or healthy enough not to have any issues, then remember that that everything starts with good health generally. Good gut health is going to impact as well. But I think that whole idea that you'll be able to just go and mop up mop up the problems later in life, it doesn't quite work that way, does it?
And I think me growing up, I don't know if it's the same for my generation, I don't know, but I grew up thinking, well, you can eat what you want as long as you brush your teeth, okay.
Yeah.
And then you realize that so much happens from the inside of your body up into your mouth, not just what you're actually putting in your mouth. And
Yeah. Yeah.
yeah.
I also actually, just one other thing to share, because I think this might resonate with people as well, is in the case of my husband, who had a sort of very expensive dentist that he would see regularly. He was told that he had gum disease, in inverted commas. A lot of people are told that, aren't they? When they're in their 50s or whatever. And he was told that he had gum disease, but he was told, well, if you come in every 3 months to see a hygienist, and occasionally, every 6 months or whatever, we'll do a deep clean. And what he was told was, it's a little bit like having diabetes. You can't cure it, you just manage it. We just have to manage it.
Mm,
Well, I now know that's not the case.
mm.
No, if you've got infection, you need to get that out. That
Yeah.
needs to go. It is not a case of, oh, let's just manage the condition. No, no, actually, that's not the case.
Mm.
So there are so many layers to this that have to be spun on their head, really.
It's,
Um,
it's very difficult because we've got sort of the biological dentists, and what I've learned that they're not surgeons. I
no,
don't feel biological dentists should be doing any surgeries whatsoever. So we've got the biological dentists, and then we've got the mainstream maxillofacial surgeons who are not biological. So there's this massive void in the middle where we need bloody good surgeons in the UK who are
yeah.
prepared to work alongside biological dentists.
Exactly that. That's exactly what's needed. And I know that, I mean, we must talk about your GoFundMe, because you've actually got a GoFundMe for some of the tremendous amount of work you've had to have done, and the fact that you're still trying to pay back your debt from God knows how many years ago. I mean, you and I both know people who've lost their homes over over sorting out their teeth. I mean, literally.
I mean,
Um,
people have literally, they've lost their marriages, they've lost their
I know.
jobs, they've lost their homes.
It's incredible. But the reason that I want to share details of your GoFundMe is because I know that when you're healed and sorted, I know you've got a real vision for exactly this, for finding a way, and there will be a way when there's, when there's that vision and there's that intention to create something, a center, a clinic, or whatever it is, where the right people can work together to create something that really is holistic. And wouldn't that be amazing? Because I want there to be somewhere for my kids to go, and I'm sure you do.
I,
And I'm sure everybody listening, will be thinking, oh God, well, where can I go then? Well, we need to build that. We need to make that happen.
yeah.
And I really believe you've got the vision for that. So just share where people can find details of that GoFundMe. And we're not asking you, we're not saying you've got to shell out thousands of quid. If everyone listened to this,
Yeah.
everyone listening to this donated a few quid, we'll be well on the way to getting that centre
Yeah.
in vision, wouldn't we, really?
Yeah, that's the thing. I mean, I like you, I found some amazing people. Um, Excuse me for saying, but sifting through all the bullshitters that I've met on this journey, it's been incredible. And I find I'm feeling now, I'm meeting, I've had this vision of a clinic for 6 to 8 years now, and I feel I'm finally meeting, I'm being shown through this path who the true people are with the right intentions and good hearts. And I'm not out to damn all biological dentists, but I feel there's a lot of gaslighting, and the type of people that go there are people often who are sick, who can't work, and their life has been even more compromised, and then they know better at the end of it. And I want to see something better for them than that, and I want to see something like a means tested, not for profit biological clinic with all the therapies to support people afterwards, because for me the aftercare is as important as the surgery itself. And
It is, yeah,
people
detoxification and
yeah,
everything
and
else. Yeah.
people are feeling abandoned, which isn't great. Yes, as far as my GoFundMe goes, I want to get well, like we all do, because I feel we can help manifest something new. We need something new here. The old style isn't working. I don't care how they package it up; it's not right. So yeah, let's all get well, and to do that, we need our health. So
Can you tell us the name of your GoFundMe, or is it not
yeah,
readoutable?
well, it's on my website, so I can give you my website.
Okay.
Do you want to put that in the link afterwards,
Yeah,
perhaps?
just if you can say it as well, and then I'll pop it in the
Okay, well,
link as
my
well.
website's www dot and then Tamaya, TAMAYA.co.uk, and there's a page under the health section called dentistry where there's some of my journey on there. There's also a petition about the regulation of indemnity insurance, because since then I found an article from 2009, I think a lawyer wrote it, where she's echoing everything that I've just written about. So I'm thinking, wow, 2009, they've knowingly not monitored the insurance. That that's no mistake, is it?
Mm.
But yeah, so that's my GoFundMe. So I've spent in 10 years about £40,000 now. I'm on a disability benefit, and I've spent many years running charities unpaid. So it's in my being to help other people, but I can't cope with debt. So I'm probably got more stuff to have done yet. So that's a good. But it's also not about donations. I say to people, even if you can't donate, can you just share?
Yeah.
Share, and it need
Yeah,
we need
because we
to
want
raise.
to raise awareness. We
It's
really
raising
do.
awareness is equally important to donations, because I'm also mindful people have got their own dental expense nightmare going on as well.
Yeah.
But anyway, yeah. So that's where you can find my
Yeah.
go. So I
Brilliant.
appreciate
Okay.
that. Thank you.
Yeah, no, we'll pop that in the link as well. Well, thanks ever so much, Jenny, for I mean, it's it's a little bit doom and gloom, this podcast, but not. But depending on
Oh,
what stage you're at, maybe we've spread a tiny bit of hope for somebody. You
and
never know.
it's preventative, hopefully.
Exactly. It's I always say, with the work that I do with sobriety, I can't help the people who are at rock bottom. That's not my area, but I can absolutely inspire people who are sober curious that, life is better. Life is better without, and that's what we're doing really. If we can catch a few of the holistic curious people, then we've
And
done a
also,
good job.
and also on the path we've been on with our surgeries, look at the people we've met with a happy ending
Yeah,
that
exactly.
I didn't believe
Exactly.
was possible.
Yeah. No,
So I
absolutely.
so I know it's possible now. So there is hope.
Yeah, totally.
We just need the right team to deliver it.
We do. Jenny Moore, thank you so much. I appreciate
Thank
it.
you, Janey. Thank you. Lots of love. Bye.